Case 16. A 6-month-old girl is brought to the pediatrician because she has been feeling poorly and has been lethargic for the past several months. The baby has also started breathing more rapidly than normal and recently had a seizure. Laboratory studies reveal a serum pH of 7.20, an anion gap of 19 milliequivalents per liter, elevated levels of pyruvate and alanine, and decreased levels of citrate. What is the most likely diagnosis? Pyruvate dehydrogenase deficiency. What is the pathophysiology of this condition? Glycolysis is the pathway that converts one molecule of glucose into 2 molecules of pyruvate. Pyruvate dehydrogenase then converts pyruvate to acetyl-CoA, which can enter the tricarboxylic acid or TCA cycle. Without this enzyme, the cells derive much less adenosine triphosphate from each molecule of glucose and rely more heavily on glycolysis alone. As pyruvate accumulates, some of it is converted to lactate to regenerate oxidized nicotinamide adenine dinucleotide, or NAD+. The elevated lactate level is responsible for the acidemia and anion gap observed in this baby. Why are alanine levels high and citrate levels low in this condition? Alanine levels are high because much of the excess pyruvate is converted to alanine in a reversible reaction by alanine aminotransferase. Citrate levels are low because there is little acetyl-CoA to combine with oxaloacetate to form citrate. What is the appropriate treatment for this condition? Treatment involves increased intake of ketogenic nutrients or foods with high fat content. The breakdown of fatty acids involves reduction of flavin adenine dinucleotide, or FAD, and NAD, and produces 1 molecule of acetyl-CoA for every 2 carbon atoms in the fatty acid chain. The FADH2 or 1,5-dihydro-FAD and NADH, reduced NADH oxidase, can be used by the electron transport chain to produce ATP, whereas the acetyl-CoA can enter the TCA cycle. Oral citrate is also helpful for replenishing the substrates of the citric acid cycle. Which are the only purely ketogenic amino acids? Leucine and lysine are the only purely ketogenic amino acids.